Hello, my name is Davor Stankovic and I teach communication. Why? Because communication is a delicate thing. Only one word can change the meaning of the whole sentence. Or even more interesting, the words can be the same, but the way you say those words, the intonation, one small pause, can change the meaning completely. Have you ever been a patient? Have you ever experienced a situation in which you feel like a doctor or a nurse is accusing you of being ill, or is telling you what to do no matter what you say? That is aggressive communication. On the other hand, maybe you have the experience where you felt that a healthcare professional didn't have control of the situation and was avoiding making any decisions. This is an example of passive communication. Neither passive nor aggressive communication brings any good. What we need to practice is assertive communication. Assertive communication is a communication style that involves expressing one's needs, opinions, and feelings in a clear and respectful manner, while also respecting the needs, opinions, and feelings of the other person. In healthcare communication, assertive communication can be used by both healthcare providers and patients to improve the quality of communication and build trust and respect between them. One example of assertive communication in healthcare is when a patient expresses their concerns or preferences about their treatment plan. For example, a patient may be hesitant to undergo a certain procedure or take a particular medication due to concerns about side effects or personal beliefs. In this case, the patient can use assertive communication to express their concerns and work with the healthcare provider to find a treatment plan that is both effective and in line with the patient's preferences. An example of assertive communication from a healthcare provider would be setting boundaries with patients. For example, a healthcare provider may receive multiple phone calls from a patient outside of normal business hours, which can interfere with their work and personal life. The healthcare provider can use assertive communication to set boundaries and communicate to the patient that they can only be reached during certain hours or through certain channels, such as secure patient portal. Another example of assertive communication in healthcare is during interdisciplinary team meetings. Healthcare providers from different disciplines may have different opinions or approaches to patient care. That can lead to conflicts or misunderstandings. In this case, assertive communication can be used to express one's opinion or concerns while also being open to feedback and alternative viewpoints. This can help to facilitate a collaborative and effective team approach to patient care. Assertive communication can also be used to address difficult or sensitive topics with patients, such as end of life care or financial concerns. For example, a healthcare provider may need to discuss the limitations of a patient's insurance coverage or the potential risks and benefits of a certain treatment. In this case, assertive communication can be used to convey the necessary information while also being respectful and empathetic to the patient's concerns and preferences. One of the formulas to practice assertive communication is this three-part structure. I understand what you are saying, however, I think that, and so on, and finishing with what do you think about it? One common barrier to assertive communication in healthcare is the power dynamic between healthcare providers and patients. Patients may feel intimidated or reluctant to express their concerns or preferences, while healthcare providers may feel pressure to prioritize medical recommendations over patient preferences. However, assertive communication can help to level the playing field and create a more collaborative and patient centered approach to care. In conclusion, assertive communication is an important communication style in healthcare that can be used to improve the quality of communication and build trust and respect between healthcare providers and patients. Using this communication style can help to create a more collaborative and patient centered approach to care. I understand what you are thinking. It is not easy to communicate assertively in every situation. However, I think that if you try using assertive communication more often, it will soon become your natural way of communicating, and you will be able to use it most of the time. So just start practicing. What do you think about it?